We're joined now by the Surgeon General, Dr. Jerome Adams. Welcome back, Dr. Adams. Thank you for joining us this morning. You know, a couple of days ago, you said this is going to be our Pearl Harbor moment, the hardest week for so many Americans. Do you still believe that, or do you have more cause for optimism this morning?
Well, the answer is both. I absolutely believe this is going to be an incredibly sad and an incredibly hard week for our country. But we've had tough times in this country before, and we always come out of it stronger. The good news is that when you look at Italy, when you look at Spain, when you look at Washington and California, and even New York and New Jersey, they have truly started to flatten their curves. They've seen cases level off and start to come down. And that's what I want people to understand, that it's going to be a hard and a tough week, but the American people have the power to change the trajectory of this epidemic if we come together like we have after past tragedies in this country.
So you have confidence in those signs out of New York and New Jersey. There's some concern that maybe hospitals have lowered their standards for hospitalization or changed their standards for hospitalization, so maybe they're not putting in people who before they would have hospitalized.
Well, initially, we were looking at an array of projections based on different people's best guesses. We now have data. The data, the facts tell us that China and South Korea are starting to reopen, that Italy and Spain are definitely on the downslopes of their curves, that Washington and California have flattened their curves because they were aggressively mitigating from the start. So the most important thing for the American people now is to really focus on these 30 days to slow the spread guidelines, because we have proof that they work. We've seen them work, but we need you all to cooperate. We need you to continue doing your part. And most people actually are. Over 90% of the country is actually doing the right thing right now.
8 states are holding out from stay-at-home orders. Should all 50 states now be under stay-at-home orders?
Well, George, I actually think that there is a lot of talk about that, but not enough talk about the fact that when you look at the cell phone data that's publicly available, and when you look at surveys, most people actually are doing the right thing and staying at home. It's also important to note that even in New York, Governor Cuomo, when we talked about a federal quarantine a week ago, which is forever ago now in coronavirus time, he said that would be like declaring war on the states. And so we don't really have a good mechanism to enforce this at the federal level as much as the states have the authority. But we really want to work with the states, and we're working with governors, talking with them every single day, working with states to give them the information they need to make the right choices. And the people are making the right choice, and that's really what this comes down to. It's going to happen at the community level.
And sir, is it reasonable to expect that we're really not going to see a return to normal until we have a widely available vaccine, widely available testing?
Well, we know that normal is going to be a different normal whenever we do reopen. We know that once we get a vaccine, we can get more back to the way we treat flu season. But we've got promising therapeutics, hundreds of trials going on across the country. And we know that once we get testing out there, more widely available, and we're going to be at 2 million tests by the end of this week. And once we have a strong public health infrastructure in place to follow up positive tests and isolate case contacts, that we will be able to get back to some sense of normalcy. And right now, we're watching China and South Korea closely to see how they do it. But I want the American people to know there is a light at the end of this tunnel, and we feel confident. And if we keep doing the right thing for the rest of this month, that we can start to slowly reopen in some places.
The director of the CDC said yesterday that he expects the death toll to come in under those horrible projections we saw earlier in the week, 100,000 to 240,000. Is that your expectation as well?
Well, that's absolutely my expectation, and I feel a lot more optimistic, again, because I'm seeing mitigation work. I am so impressed. I know I've said it a couple times with Washington and with California. Their public health officials there should be applauded, because they've given us the blueprint for how we deal with this in the rest of the country. And I really do believe that we will come in under those projections as long as we can continue to do our part for 30 days, staying at home, avoiding unnecessary travel, not gathering in large groups.
A lot of voters in Wisconsin are going to have to face that dilemma this morning. As you know, the election is going to go forward in the state of Wisconsin today. And Justice Ginsburg said overnight in her dissent from that opinion approving the election, quote, the voters will either have to brave the polls, endangering their own and others' safety, or they will lose their right to vote through no fault of their own. As a public health official, as Surgeon General, what's your recommendation to the citizens of Wisconsin this morning? Should they go vote?
Well, my recommendation is that if you can vote remotely, and I'm not familiar with what other options they have available, please do that. If you can't, then please try to maintain 6 feet of distance between you and the next nearest person. And also, please, this is one situation where I would really say consider wearing a cloth facial covering. I have a video out that you can easily look up and make one out of household items in just a few minutes so that you can protect your neighbor. Remember, we wear these cloth facial coverings to protect our neighbors. I wear mine to protect you, George, and you wear yours to protect me. And if you go out in Wisconsin to vote, please wear one to protect your neighbors because we're all in this together.
Dr. Adams, thanks for your time this morning.
Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.